Hello friends, I'm Dr. Amit and we are going to talk about post-operative instructions after a hair transplant in this video. So anywhere in the world where you are, anywhere in India or across, if you've done a hair transplant, please remember these are the most important instructions that you must follow in order to get the best result. Now that you've had a hair transplant, remember you need to take antibiotics. Antibiotics need to be taken once a day for 5 days. We recommend Levoflox, Levoflox. Levoflox 500 milligrams just once a day for 5 days. We always suggest 2 painkillers, Ultracet and Voveron. These need to be taken morning, evening after eating something for 2 to 3 days at the maximum. If you want to avoid swelling. Dear friends, thank you for watching this video. Please like this particular video and subscribe to my channel. This will give access to all the upcoming amazing videos that we are going to put up and also open up all the other videos that I have posted so far. If it's such business you are in where you cannot afford to have swelling, then you need to take 2 tablets, tablet prednisolone, 10 milligrams 3 times a day, 3 days, and tablet Lasix, 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 20 milligrams morning, evening. You will never get a swelling. If you're okay with a little bit of swelling on the forehead, then you can skip these 2 medicines. If you have any history of gastritis, you must add RANTAC 150 milligram tablets at the time of taking these. So morning and evening, before your breakfast and before your dinner, please pop in a RANTAC. And it's a good habit to have a lot of curd with your food in order to avoid gastritis. Second day onwards, so you've done a surgery today. How do you go back and sleep? Sleep like this, sleep on your sides, but don't sleep face down, simply because you might rub some of your grafts out. Don't wear t-shirts for 1 week. Taking in and out might dislodge some hair, and be careful of things above your head. So for example, you're walking down a basement, or you've got some cupboards in your room. If you're traveling in a train and you accidentally hit anything on top of the head, some hair might fall off. So remember that. If you have had a transplant on the back of the head, don't worry. We have seen there's never a problem. It never touches the back of the head. But always sleep on the opposite side of the head end. So if this is the head end of the bed, sleep on the opposite side. So accidentally you don't rub your head against the back part. Then some patients have complained of a little bit of pain at night after a transplant. So we recommend to use warm compression. So use a water bag or a warm towel on the back of the stitches or the back of the FUE for a few days to avoid that pain. Avoid exercise, avoid any sports for 7 days. The reason, we don't want the blood flow to rise up here and throughout the hair. Avoid smoking, avoid alcohol for at least 7 days after a hair transplant. It is mandatory. If you are on any blood thinner medicines, you can start on the next day of the hair transplant. That's not a problem. Shampoo. You can have a bath generally, but we generally recommend shampoo on the 3rd day. I recommend Kevin Murphy shampoo, KM shampoo for all my patients. It is very safe. It's very soft to the hair and protects the skin. I personally use KM myself. So 3rd day onwards, start using KM every day. If you have an oily scalp, then shift on to an anti-dandruff shampoo, something like Keraglow AD, Keraglow Anti-Dandruff AD shampoo every day for 2 weeks from the 3rd day onwards. If you're doing PRP, then 1 session would have been done on the day of the procedure, and then we suggest 1 session a month for 6 months and then once in 6 months. So that is pretty adequate. We also recommend the use of vitamins. There's a kit which is called FACT, FACT, that is recommended from the 3rd or the 4th day onwards for a period of 6 months to 1 year. Just 2 tablets a day, and they really strengthen your hair. If you have done FUT, the stitches are generally taken out around the 14th day, or if like we put dissolvable stitches, you don't need to take them out. You can wear a cap from the next day itself and don't need to cover with anything. Just wear a cap, cricket cap, don't wear winter caps, and you can actually go to office as soon as the next day. You will also be receiving more videos about how to manage day 1, day 2, day 3, and if you have any questions, please let us know. We'll be happy to answer those.